Good evening, everyone. I am Richa Sera, Editor-in-Chief, Responsible Hospitals. Today, again, I welcome all of you towards a big subject, which is a breast cancer awareness. And breast cancer awareness is something which I think everybody nowadays should know about it. It's a very, very critical subject wherein many of the women and frequently now are getting into it, but they are not able to cure it because it's too late. So better we know about the symptoms on the early stages so that we know and we can just try to hold on those things and we can cure many lives. So guys, today my guest will be Dr. Aruna Kalra, who is one of the renowned doctor and a very senior gynae with CK Birla Hospital, Gurugram. She will be talking about breast cancer and the subject throughout and in very depth. So I'll be just adding her here, and I hope I'll be able to connect with her now. Just a second. So by the time any of you, whoever is listening to me, in case you have any questions regarding this subject, this is the right platform, right place to talk about it, to ask me questions. I'm going to pick up your questions. I'll be asking the doctor. Guys, I'm just trying to add the doctor. There's a big network issue today. I'm sure I'll be able to add her soon. Yeah, I can see her live right now. I'll be adding her in a moment. Dr. Aruna, I know that you're live. I'll be adding you right here. You would see me, you would see my request just in a moment. Yeah. So guys, we'll be live soon, and thanks for your patience and for waiting for us because it is the second time. Good evening, Dr. Aruna.
I am really sorry. I'm very handicapped.
That's okay. That's all right. That happens with a lot of people who are new to Insta Live because people are quite in terms of Facebook Lives. So we are doing little different to have Insta Lives to have a different audience with us. So that's all right. First of all, I would like to welcome to you. For the first time, you are joining our session on responsible hospitals, and it's a great thing which we have been doing now because it's a month of breast cancer awareness, and we thought to do something about it. We were not able to initially. So it's great to have you here. Thanks so much. Yeah. So, doctor, since you know that it's so frequent these days that a lot of women they are getting and developing this kind of cancer. First of all, what is your thought about it? Are people not aware, or are they not sure? They are not examining themselves, or they are trying to hide this disease, or they are scared to get this check from doctors. What is your thought and opinion about it?
Okay, so hello everyone. It's a really nice topic, and I would tell you that post-delivery, mostly females, they pass around in their antenatal when they are pregnant, and this is my duty to inform everyone postnatally to screen yourself for every kind of feminine cancer, whether it's breast cancer, cervical cancer, or ovarian. So this is one of the very important topic and discussion, how to do breast examination. And as you rightly mentioned, that people are not aware about breast cancer, or most of the time, yes, they know something is preventable by some vaccine, and they think that it is breast cancer, which is cervical cancer, HPV virus causing cancer. Breast cancer is preventable if you know how to diagnose or how to see signs of early breast disease. And girls, yes, I would say 10 educated people are definitely aware, but they are not aware of breast cancer. They are not aware how to do it, how frequently it should be done, what can to increase the risks of breast cancer. And only very small population. It's only 10% population which is actually aware. But otherwise, most of the population is not aware. They have no idea it's required. Breast cancer examination is required at all.
So sure, doctor, you correctly said, right. What do you think? What are the signs and symptoms of breast cancer?
Okay, so first thing is every aware uh, and conscious about their breasts. You should not be shying away. You should examine your breast once you are having your shower and see whether nipples are at right position. A little up and down would be there. Position should be more or less at the same level. One. Skin should be normal. There's some dimpling of skin. It means some kind of lump is growing beneath it, and which is pulling the fibers, and that is what is causing dimpling of skin. Any kind of ulcer or some itchy lesion or rash which is repeatedly happening, and you are trying some cream when it is getting treated, again after a week or two it reappears, it means something underneath is brewing and you should get it checked. And as I said, position of nipple at one level is important. Again, nipple should be normal nipple. If you have both flat nipple, that is okay. But if you had normal nipple, pituitary nipples, and one is getting flattened or inverted, or once you pressed your nipple and some blood stained or greenish discharge is coming out, it is abnormal. Sometimes, yes, galactoria, watery discharge also comes. And anybody who has breastfed their babies ever in their life, uh, both the breast would leak if you try to squeeze. That is both breast galactoria, which is very, very common. That is not cancer, but single nipple is oozing blood, green, or any kind of clear liquid, we should always get it checked. Uh, and if you lift your arms above your head and you see that nipple is getting pulled at one or the other side, it means some lump is pulling it towards that side and it's not going up as it should go with your both the arms. So rash, nipple discharge, nipple changes, skin dimpling, any kind of lump which is seen only by look at it, you can see. Those are just looking at it. Then you should know how to examine it also. So and these are signs and symptoms. Are sometimes and most of the time we say that breast pain is not a symptom of breast cancer. Mostly, if it is breast cancer, very microscopic lesion would take 2 to 5 years to grow to a size to actually feel it or palpate it. Even doctors cannot palpate very small lesions. So, palpable lump takes 2 to 5 years. It means that you were having breast cancer 2 years before, and now it is diagnosed. So that is how it is difficult. Lump is difficult to diagnose, but anybody feeling funny, that a little uncomfortable feeling is there, and most of the time we overdiagnose. You have fibroadenoma only or fibroadenosis, which are benign diseases. We diagnose, and it is better to diagnose a benign disease rather than not able to diagnose a malignant lump. So, would be going forward and discussing how to examine. I guess you will be
Yeah,
asking.
yeah, I'm going to ask that question because I'm sure still a lot of women do not know. And when they examine, they find little lump, which they find, even if there is no lump, they might try to find one and they feel that there is a problem. So, how to actually identify that, this is something which needs to be shown to doctor, or this is something which needs to be ignored. So it's quite a difficult decision. Or maybe we can suggest, if you can suggest, that they should actually seeing a gynae once in a month or once in 6 months, because we all go to gynaes when you actually conceive. Other than that, we try to forget that there is a scope and you actually need to meet them. Yeah.
Okay, so I would say that breast self-examination should be a routine thing, and it should be cyclical, as we say, like after every 3 months. Or yes, if you ever feel that you are feeling something, you should go and examine your breast. And yes, third monthly cycle is important. who are totally
Sure.
so breast examination is done post menstrual.
My phone battery was going off. I have to put the charger on.
Okay. You
Yeah,
also
just a
near
second.
the charging point before my so
That has happened for the first time with me because I was like, it will run for half an hour. That's all right.
looking so real thing. I should always look real.
Yeah, absolutely.
Okay. So and there's very less also. Okay, so yes.
Yes.
So audience, how to do breast examination, when to do breast examination, we should know. So first thing is it should be post-menstrual. It should because post-menstrual your breasts are less bloated, and it's easier to diagnose any lump. Uh, when you are examining your breast, you should lie down, and the breast you are examining should be like that shoulder should a pillow should be put under that shoulder. So if I am examining my right breast, I should put uh, I should make the breast very comfortable on the rib cage on my chest wall. So once it is the whole breast, because sometimes breasts are bigger and it is hanging at one side, that is not a correct position. So once it is on the rib cage, you have to palpate with flat of hand. So you should never palpate with the tip of finger. You should always palpate with the flat of hand. If you'll feel with tip, every lacteal gland would feel like a lump. But if flat of hand with two flats of hand, if you just as if you are palpating dough, if you palpate that and you are trying to find some potato, small potato, that's how you have to feel. And once you'll feel with the flat of hand, you'll not feel any lacteal gland. You would only feel a hard lump. And then you should either do circular motion or vertically you should cover your breast, or cartwheel type. So any way you have to completely do breast examination from the rib, here clavicle till the last rib, and then midriff यहाँ से लेके or axilla, so till axilla. So this is your whole breast which you have to examine every third month. And with the clinician, you should be going every year. That is the best thing whenever you go for pap smear or for any other thing, or if you do not have any other thing to go for breast examination only. Get yourself checked. Uh, Better would be clinician doing your axilla examination also. There is axillary tail of breast in axilla, so that they examine that. They examine lymph nodes here and just above clavicle. So that is an extra advantage going to clinician. They are able to diagnose any extra lymph nodes also if they are enlarged, and that is effective way of doing breast examination. This is one is examination. There are many other methods of screening also. I think Richard would ask that.
Yeah, I have that question too. Before that, I was asking that since you were just mentioning about the lungs, and that is quite understood. Now, is that important that that lump will be painful? Then only there's a problem, or that lump can also be like just like that and staying and not harming the body. Still, they have to see the doctor.
Okay, so as I said, that 80 or 90% lumps would not be harmful, though those lumps are not cancerous. Those are just fibroadenomas, and most of the time, yes, people come with fibroadenomas, and we reassure that it is a hormonal thing. It would disappear, or even if it won't disappear, it is not harmful. It is not going to turn into cancer, so you should not be worried about that. So it says that because our hands are accustomed to see whether it's fibroadenoma or whether it's cancer, and cancer, as we know, that lump is either fixed to skin or it is fixed to muscular tissue down there. So fibroadenoma, if a lump is hard, which you have felt, and then when once you start moving that lump inside the breast, it is movable like a mouse. It is called breast mouse. It can move from one point to other point. But if it is breast cancer, it would be fixed to either skin or the underlying muscle, and you're not able to move it farther than its original point. So that's how we are able to diagnose. And if there
Okay.
is suspicion, we always go for other tests.
Sure. So here we can talk about which are the tests which are available and how do you screen that.
Okay, so as we know that yes, breast cancer is a disease of a little elderly, 50 and beyond, but nowadays having family history, genetic BRCA gene positive family history or all those things, younger generation is also is prone, and very very important point because of obesity, many young girls are prone for so we suggest that yes, as previously we were suggesting for cervical cancer, as soon as you're sexually active, you should go for cervical cancer screening. Same way for breast cancer, we are suggesting that if you have a high risk factor, like if you started menses before the age of 12, if you are obese, if you have not conceived beyond the age of 30, and why I'm telling all these things is because estrogen exposure to your body is more if you had early menarche, if you have not conceived and you had those 9 months period of low estrogen and progesterone protection is not there, and then when you are lactating again, there is no estrogen or low estrogen. So those protective periods are still not there in your life till the age of 30. So you are prone for breast cancer, all these or infertility treatment if you have taken for a longer period. So all these things make you prone. Sometimes, and screening means that if you are beyond the age of 40 and beyond, mammogram is required. But before that, clinician examination by clinician, or if clinician feels that ultrasound is required, we would do ultrasound. Because younger breasts are denser breasts, mammogram would not give a good diagnosis, and that is why anybody who is less than 40 and we feel that there is a suspicious mass or suspicion of breast cancer, we go for MRI. So if somebody is 40, it depends on your concept normal, one thing. Family history, you have genetic uh, uh, inclination breast cancer, all those things depend, and on all
Doctor, I'm losing the
those
network.
things, we
Your voice is
mammogram
cracking.
should be done because it's a radiation thing, and we do not want you to get exposed.
Can you hear me? Yeah, your voice is cracking a lot now, and the screen is also paused. Can you hear me? Is it? Can you hear me?
Yes, yes, I can hear you.
But I can't.
I can hear you.
Okay, now I can. Yes.
Okay, so I shall go.
Only the last two lines I think we missed. Mammogram you were talking about.
Mammogram. So I was telling that
That's not
mammogram.
sufficient.
You can hear me?
You were mentioning about that. Yes, yes. Please go ahead.
Okay, so it was after the age of 40 we say that
Right.
how you should go, and it depends upon high risk factors, family history, and we do not want extra radiation dose to anybody. Okay, mammogram causing some kind of cancer. So we would want that after every 3 years or 5 years it should be done. If but genetic um,
Okay. Your screen is paused. So, doctor, what are the type of breast cancer? Are there any types? What are the type of breast cancers? I asked.
okay, type of breast cancer are okay. There are many types like receptor positive. Okay, so basically, one is intraductal cancer, another is invasive ductal cancer, One is inflammatory breast cancer or metastatic breast cancer, total rate of breast cancer. So, depending upon histopathology, like when we do biopsy, we get to know what kind of cancer it is. Severity also depends on staging, grading of breast, and then we check whether it's receptor positive or not, estrogen receptor, progesterone receptor, HER2 receptors, and prognosis and treatment. Further treatment depends upon all these.
Okay. So, doctor, coming back to the self-examination part, so is there any age which you suggest that this is the age now people should start checking out and start doing the self-examination?
Okay, I would suggest that, see, we as a doctor, we have been seeing younger population also now getting diagnosed at the age of 25, 30. So I would suggest that as soon as you are aware about your breast, you should start examining now. Young, so and a bad thing, but most of the girls are smoking, they are consuming alcohol, and all those things are high risk things for breast cancer. And uh,
I was losing the network again. There's a network issue, it seems to be.
is it okay?
Yes. Yeah. Yeah.
I guess
Looks like that.
there is okay, huh?
Yeah, maybe
Okay, so
changing
as
the
I was
place will be better.
so okay, so, younger girls, because they are consuming alcohol, smoking, hookah, and many other things, and they are consuming hormones also. Not a trend few years back. Consuming junk food, uh, uh, obesity, polycystic ovarian disease syndrome, everything has abnormal hormonal milieu in their blood, and they are prone for breast cancer also as the cancer. So I would suggest as soon as they are aware, at the age of 20, yes, start these breast self-examination. And girls who are sexually active, they are going to, and nowadays we are very, very open about get your pap smear done, get your cervical cancer done. And once you come for pap smear, uh, please get your, everybody is prone, no age is but after the age of 50, chances are more, but now we have high risk factors, younger age group. They are also prone.
Sure. And doctor, what do you think, since you just talked about lifestyle, how lifestyle actually affects and impacts on the body, also, do you think any genetic thing, why people think that, why did it happen to me? It was not there in my family, or is it related to any genetics? So, who are more prone to get such cancers?
Okay, so first thing is, yes, like if you are not doing any exercise, if you are on a high BMI side, your estrogen level in fat has estrogen receptors, and if he is obese, estrogen is high in their all they are exposed to, so they would be at high risk. Lethargic lifestyle and no exercise, obesity, food, alcohol, smoking, everything. Another thing which increases is and late conception, no breastfeeding. Uh, for a, later age group, hormone replacement therapy for higher dose of hormone replacement therapy, also breast cancer. And then genetically, you are a carrier of BRCA, you are prone for breast cancer. That everybody knows. Like if your paternal aunt or your mom is suffering or was diagnosed with cancer, you should be getting your mammogram and examination also. And BRCA gene is like ovarian cancer is bone breast cancer again. So once you complete your family, try to get rid of any cancer, which is seed for cancer.
Sure. So my last question to you is today that what are the tips you would want to give to people who really want that they want to take initiative or they want to cure that it should not actually get spreaded over, or maybe we can just stop it right here.
Yeah, yeah. So awareness is the first thing which you should know, and awareness for every. So I would tell you 5 things for a female. First thing is, as soon as you're sexually active, uh, use contraception. Barrier method is best. You are in monogamous and single relationship. You should be using to avoid unwanted pregnancy. Not take morning after pills. One. Second thing, get yourself vaccinated for cervical cancer, which is the mouth of uterus cancer. Get yourself vaccinated, but still you have to get pap smear done. It is a cervical cancer screening test. Breast examination you should learn from your obstetrician. Go for breast examination tutorial and try to do it. And when you go for pap smear or for any other discussion, because gynecologists would forget to do breast examination. Go post request them to do breast examination. Another fourth thing is like is very, very important. Again, for every female post delivery and the late age, perineal muscles go weak, and around 40 and 45, once you cough, start dribbling, and you would feel that moms are complaining that. So, Kegels exercise, everybody start from the beginning. Uh, um, so, I think Kegels is one. Another, medical examination of breast is one thing, and no after contraceptive pill. Otherwise, contraception is really, really own health. Do not please take junk food. Exercise regularly. 60 minutes would go for very, very. It will be very helpful. No to alcohol. Occasional is okay, but no to smoking. Boys and girls both. And the cervical cancer vaccine is again for boys.
Perfect. Thank you so much. It was great. I think I was also listening it very carefully because these tips are important for all the women. So thanks for this, commendable session. I think it was really great to have you here, and we'll meet you soon for your in-person interview.
Thank you very much. Thank you. I'm
Thank
so
you.
and thankful to you.
Thank you so much. Bye bye. Take care.